Well, welcome back. I hope you enjoyed your short intermission. And now we're gonna begin with, brain cramps. Seriously, brain cramps. Michele Reyes, she's the vice chairman of the Hypoparathyroidism Association, and you've been hearing from her all weekend, so I'm not gonna go into exactly what else she does for us, but she does a lot, and we thank her for that. And I also have the pleasure of introducing Katie Gillick. Katie Gillick is an advocate, and she works with NORD, and she's also, I believe, a hypopara patient, and she's also coming aboard to help us with our advocating matters that we have. So without further ado, I'm going to turn the program over to Michele and Katie.
Thank you, Loretta. I am so excited to be here today and share with everyone everything Katie and I have been working on this year. Katie, I'm going to start with a little slideshow, and I'm going to go and then I'll let you go. I'm going to share my screen with y'all from the beginning. So today we're going to be talking about advocacy and how it is more than letters in Capitol Hill. And first, though, before we go to that part, I want to let you know that the letters you did write, I have to send out a huge thank you to our community. We had 171 letters written from 21 different states, and we got their attention. And Katie, you can chime in to let them know, how many meetings did you have with Congress people?
Hi, Michelle, and hi, everyone. I personally attended 5, but I believe there were more that took place that I wasn't in. So we had several.
Yes, so that was exciting news. And I do want to share that Katie and I worked with a gentleman named Bill Burke, who was supposed to be here with us today. Unfortunately, he had a family emergency, and so he wasn't able to be with us. But we're hoping at some time in the near future that we can sit down with Bill and have a bigger conversation about how the Capitol Hill side of things works. And Bill has had several meetings on our behalf to help us out, but we did finally get the attention of the FDA. They asked to see your letters, and we are in talks with them now. And we hope that it just encourages them to help us out with getting multiple treatments approved. So I'm going to move on from that because today's talk, well, actually, I forgot. My next slide has a couple of statistics real quick. I just want to share with you about what happens to those letters. And it's, in fact, 96% of Capitol Hill staff reported in a survey that if their member of Congress had not reached a decision on an issue, personalized letters like what you sent would influence his or her position. And that handwritten letters from constituents of members of Congress are always read and always logged. So that is why those letters were important. And on the screen, and mind you, these slides will be available on our website along with this presentation. I'm listing 3 sites that list other ways to get involved, such as the Chronic Disease Coalition. They will educate you there on policy issues, what some of the different Capitol Hill terms mean, how you could get involved at the state level. The second website is raredisease.org, and that is NORD. Now, NORD doesn't just get involved in policy issues. They have many more things that they get involved in that Katie and I will both be discussing later on in our conversation today. And then the third site is patientsrising.org, and they're similar to NORD. They do a lot of advocacy work, but they have some other areas just besides policy that they work on. And we'll be sharing those with you as well. But I wanted you to have this resource so that you can go to them later and investigate for yourself and see if you want to get more involved. This is a map that shows rare disease advisory councils that are in each state. So the light blue is states that have a rare disease advisory council. And the orange are states that ones are in the process of forming. And the dark blue, they don't have a rare disease advisory council. And a rare disease advisory council is something that gives individuals a voice in their local state government. You can help, and I just recently joined my state's Rare Disease Advisory Council. You can help with things like affecting healthcare in your state, insurance coverage, because insurance coverage is a state by state kind of thing. Some people think it's national. Your policy might cover you nationally, but there are a lot of things that are covered under insurance that are state by state issues. And you can have effect on how your state Congress people and House of Representatives treat rare disease or see rare disease. So I wanted you to know that those are things that are available. And if you're interested in getting involved just to get started, or just to see what is your Rare Disease Advisory Council doing for you in your state, you can check this information out online. So then the next part of my talk is going to be more about what can we do personally to help ourselves or advocate for ourselves in the rare disease space. And not just, like I said, not about Capitol Hill letters. We're going to go away from that now. So my section today is going to be about what can we do with our insurance? Because I'm sure we've all been in that situation where we've had a medication denied or a scan denied or something. So this is going to be beneficial, just not for medication, but for all things you experience with your health insurance. And so I wanted to go over some key terms. Now, if you go to websites like we suggested before, such as NORD or Patients Rising, they will tell you that there's 12 key terms you should know about your insurance and understand before you start advocating for yourself. I'm not going to go over all 12 terms today, but I am going to go over some of the ones that I think are really important for you to know and understand the difference of. The first one that I'm going to go over is copay versus coinsurance. And so the copay is the amount you pay each time you receive a service. In other words, like your prescription or your office visit, or you go for an MRI, the amount that you would pay at the time of that service, that is your copay. Your coinsurance is the amount you pay for services after you've met a deductible, but before you've met your out-of-pocket maximum. And some people don't realize that there is a difference, and they think that, oh, I have this copay and that's all I have to pay. But that's not always the case. So it's important to know how your insurance is set up, because not everybody's plan is set up the same, and know that you may have to meet a certain amount of insurance liability all the way up to your out-of-pocket maximum. And for example, like with my insurance, I have a high deductible insurance plan. And so I have one set of amount that I have to meet that is not my total out-of-pocket expense, but I have to meet $5,500 before the insurance will pay anything. They won't pay a single dime until I meet $5,500. Then after that $5,500, all the way until I meet my out-of-pocket maximum, which is $11,000, I'm sad to say, then I have this co-insurance that I pay. So it's a percentage of each office visit, which is different than having a copay per se. So it's important to know those differences, because if you're going to go to your insurance and say you didn't pay for this particular item, you have to know, well, am I in that period where I'm paying this deductible down first before you will pay for anything. Then the next term I would like you to know about is prior authorization. And maybe some of you have had some experience with this before. I know when I was on NotPara that that was something that required a prior authorization, and a lot of medications do. So maybe you've experienced that. A prior authorization, for those of you who have never had to deal with it, is a requirement by your insurance company to get authorization for the healthcare service or treatment before it is provided. So if you were to take the prescription to your pharmacy and try to get it filled, they would say, we can't fill that unless you get a prior authorization from your insurance. And you need to know that a prior authorization could take anywhere from a couple of days to a couple of weeks to sometimes a couple of months to get approved. And the Office of the Inspector General found that 13% of prior authorization denials through Medicare were for treatments that would otherwise have been covered. So it's important to know whether or not first of all, your health insurance requires one, but it's also important to know how to navigate a prior authorization and to make sure that you have all of your paperwork ready before sending in the prior authorization. Now, we're not going to go into the great detail today about how to get that paperwork ready. I will use this opportunity to say that we are hoping forward going in the HPA that we are going to be able to set up some sort of system online for you to be able to have references and tools to navigate that system. Currently, there are some other organizations out there, NORD is one of them, that has a system online set up for patients of rare disease, how to navigate that prior authorization process. So that being said, though, there are letters and things that need to be written, and it's always good to try to work well with your provider and make sure that you have all that paperwork in before you begin the process so that you're less likely to get denied. But then there are steps that there are organizations out there that can help you once you have a denial. Step therapy is the next insurance word that we would like to cover. Some of you may or may not have experienced this before, whereas maybe a doctor has given you a prescription for a medication, and the insurance company comes back with, before you can have that medication, you have to try the generic, or before you have that medication, we want you to try this other medication that you've never even heard of. So it's the process by which an insurance company makes the patient fail first by trying one or more less expensive therapies before approving the therapy that they're looking for. It's unfortunate that insurance companies do this because it's been proven through different studies that this actually increases the cost to the healthcare system, because you have a patient who's getting worse and worse and worse and may actually now need more therapies because you denied them that first therapy. So that's an important one. The next one I would like you to be aware of is a letter of medical necessity. And this is something that your doctor can have prepared that explains to your insurance company that you need a certain treatment, even though your insurance says you don't. And this is something that will usually coordinate alongside with the prior authorization. It's good if you have the letter of medical necessity written prior to applying for the prior authorization. It does need to be written by a medical professional. It doesn't mean you can't help with the wording or, getting prepared for it, but it is something that does need to come from the medical professional when it's being presented to the insurance company. And they will need to explain why this is the only treatment that will work for you. And I have included some websites, again, one of them being Patients Rising and another being an organization called coveragerights.org. And they have some examples, great examples on there of how to write a letter of medical necessity. But it's very beneficial to have all that stuff ready and waiting to go, especially in this world where we are looking at potential treatments coming up. These are things that you can do to help prepare yourself for when these treatments come to market. Have these things ready with your doctor. Have these discussions ahead of time before the treatment comes out. Are you willing to have me go on this treatment, and how can we be prepared for the day that it happens? So this next slide I have is some resources. And again, you don't have to memorize all these resources. We're going to get these posted for you on our website. And I would like to tell you a little bit too in this section about Katie and I have both been taking a course through patientsrising.org that is an advocacy masterclass. It's a 15-week course. We're only about halfway through, Katie. Think.
Speak for yourself, Michelle. I'm a little bit further behind.
So it's a 15-week course, and they they give you a little flexibility on how long it takes you to take it. It may take both of us a little longer than 15 weeks. It's a lot of information, and Katie and I both do work full time. But they go step by step. How does Congress work? Let me tell you, it doesn't work like I thought it did. Then they go into what is a pharmacy business manager? How do pharmacies work? How does your insurance work? What is step therapy? We have a class coming up, I believe, on how to talk to your insurance company. So I'm hoping that by taking this course in the future, Katie and I, and maybe we'll get some of you to help us out, can help you guys better, and that we can provide some resources on our website on how to better advocate with your insurance company for yourself. But these are a list of some resources that I've gathered already just from some of the classes I've taken. I'm not going to read each individual website to you, but a lot of these are also focused on not just how to advocate with your insurance company, but you'll notice some of the titles are copay assistance and financial assistance. So we've already started to learn a little bit about, there is a lot of money out there available. You've just got to learn how to use it or how to apply for it. But there are a lot of copay assistance programs. And so I've included some of the websites that discuss those type of programs and how you can go about getting copay assistance for not just your hypopara treatments. Maybe some of you are on heart treatments or other long-term chronic condition treatments. These websites can help you with your rare disease treatments or your other treatments. And they even will help with travel assistance if you have to travel a long ways to go to a doctor's appointment. Maybe you need to go, maybe you live in a rural area and you need to go to a center of excellence, like an MD Anderson type situation or a Mayo Clinic. These companies will help with those types of things. You'll also notice down towards the bottom of the page, there's one that will even help with medical alert assistance program. They'll help you if you can't afford to get a medical alert, a bracelet for yourself. They will help you with that process. So we definitely want to see you utilize some of these things, how to make your insurance work for you. And we hope you will take a look at some of these resources. And then if you do have questions, reach back out to me. My email is mrays@hypopara.org, or you can always send questions to admin@hypopara.org. And we would love to try to help you. We may not have all the answers now, but we're willing to work to get those answers for you. And with that being said, I think I may have talked a little fast, but I'm going to turn it over to Katie and let her talk to you about advocating for yourself.
Thank you so much, Michelle. And I don't have any slides to present. And so you all are stuck with looking at me. And this is actually for those of you who have visited our grassroots toolkit for our advocacy campaign and wrote us those beautiful letters. You might have seen me before. And so I had helped with that initiative as well. And we really received a great response. 171 letters is fantastic. And we're really, really grateful for everyone who responded and who helped us bolster that advocacy campaign. I can speak personally to the fact that I was in, as I had said, at least 5 of those meetings with various legislators' offices. And we did actually refer to earlier on when we had just a few letters, whenever there was a state with a constituent in it that where it applied, we did try to refer to the letter that was written for that state. And so know that your words may have been echoing through the halls of your legislator's office. And, we're really grateful for your help. And as Michelle had said too, we're excited to continue to build out the advocacy arm of HPA. And we love to see more of that engagement. And so I come to you today as a new member of the advocacy committee with HPA, and also a new member of not a new member of NORD, but a new co-state community ambassador with the Rare Action Network, which is facilitated by NORD. And the Rare Action Network is that body of volunteer individuals filled with advocates, et cetera, who help to get RDACs implemented in our states, and Connecticut just recently passed ours, which is where I am. So I'm in Connecticut. And so, but most importantly, aside from all of that, I come to you today as a patient, and that's kind of the point that I wanted to relate to you on, and the point that I want to hammer home, and really just use this opportunity to reinforce how valuable the patient voice is, and remind you kind of through you know, some of the things that I've done, that like it is enough to just be a patient. And it's interesting because in kind of preparing and thinking about what I would speak to you all about today, and in some of my conversations with Michele, she's not going to be expecting this, but she likes surprises, I hope. So I found in my chart messages, and I'm sure many of you know what my chart is, or my chart plus, or whatever your patient portal is that you use to communicate with your doctors, a message that I had sent to my surgeon, this from the surgery that I had that ultimately caused my hypoparathyroidism. And so that gives it away. I'm a post-surgical patient. I am of the majority of you, so I can relate to that experience. And this, I think, for me, embodied kind of really what the essence of patient advocacy is. And if I had to show or ask for a show of hands, if I was standing in front of a room of you and I could see you, I would ask for a show of hands to illustrate to me how many of you, like me, were ever intimidated by sitting in front of a doctor and challenging them, and because they had MD after their name, even if you knew that you didn't feel well, or you weren't getting information that you needed, or you had questions and you were too afraid to ask because there was a power dynamic difference. I'm sure I'd see a number of hands. Similarly, if I were to ask you, how many of you ever felt that you weren't qualified to ask questions, to make those challenges where respectful and appropriate, because you were not as highly credentialed as a person that you were sitting in front of? And, you know, that's an experience that I've certainly lived, and an experience that I would anticipate probably is shared among not just our community, but really the patient community at large, and especially in the rare disease community as well. And so with that, I think, you know, I hope you'll excuse my wandering eye, but I have a second screen, and I'll just kind of share a portion of the message that I had sent, and I'll preface it with, this was sent to my provider back in 2020, when I had heard that, you know, my surgeon was potentially involved in the hypopara community and doing some research. And I was hopeful that some of that research might, you know, yield a benefit to me, you know, in a clinical trial or of some nature. And ultimately, I found out that the research was just too early and it wasn't yet available. But when I had found that out, I messaged this person and was asking how I could help. And so I said the following: "Dear doctor, you're about to get what I imagine may be an unusual response. What can I do to help? I'm not an MD or an RN or a JD or a PhD, but I can offer you a fierce determination stemming from firsthand patient experience as to how much this condition sucks. I was never good at sitting the bench, and I don't plan to get better at it now. Tell me what you need: outreach, fundraising, awareness, networking, coordination, research. I do not get a break from this condition day in and day out, and I do not plan to give it a moment's rest. Tell me what needs to be done and how I can facilitate it." And so that was me in, I think, a moment of frustration, and also determination, saying, I know that there are needs. I know that, you know, you don't have everything you need, and the patient community certainly doesn't have everything we need. What can I do to partner with you to help you? Unfortunately, I did not happen to receive a response to that message, but I didn't let that lack of response stop me from continuing to advocate and get involved in other ways. And so I saw opportunities with NORD. I saw opportunities with HPA. And, you know, I am very, very fortunate to be under the care of, you know, some amazing physicians now who do specialize in hypopara, and that has made an incredible difference for me in the trajectory of my treatment. But that being said, you know, while it was valuable in a sense to recognize, look, I don't have your credentials. It was just as valuable to me to say, hey, wait a second, you know, yes, I'm just a patient, but so what? You know, I'm gonna take what I have and turn it into, you know, a powerful response and assert my voice and get things done in my sphere. And in doing that, I was seeking a partnership. And that's an element of advocacy that I really wanted to convey, because when we're in these patient-doctor dynamics, right, there are differences between, you know, dealing with an expert in medicine and you as a patient. Most of us are not, you know, necessarily experts in the academic sense, where most of us don't have MDs, right? But I think speaking for myself, in my most successful physician-patient relationships, it's due to the fact that there's a recognition by me as the patient that the doctor is an expert in medicine. And there is a similar and equal respect from my physician in recognizing that I, as the patient, am the expert in my body and the expert in my experience with my body. And that relationship, that relationship fosters a mutual respect that allows for productive treatment, at least in my most successful relationships. And that's just something I wanted to float out to all of you as a reminder that, you know, there are two parts to that equation always, and they're equal parts. They're different. And each part has to respect the other, but both should respect the other. And you know, that's just one of the ways that I've seen things work for me, or not work when the balance is not in line. As you know, kind of another element of that, which I think Michele might piggyback off of a little bit, and I'll keep it brief, is you know, I'm as a young woman, right? I don't mind sharing my age. I'm 27. You know, I grew up, you know, with certain values, and that included respecting authority. You know, I was brought up to, you know, be raised to respect my elders and my teachers, and you know, and really people in authority in general. And it was really, really difficult in the setting of, you know, a patient and doctor relationship, especially earlier on in my diagnosis, to look at, you know, a physician and say, you know, I don't agree. I'm not sure if, you know, I understand, or, you know, can you help me understand better how this medication is going to affect the other one that I'm taking? You know, all of those things are ways of challenging, but they can be done in a respectful way. And to learn that skill, like, that's what I think about when I think of self-advocacy. And part of how I learn to prepare for that, so I don't get anxious or caught up in the moments where those things occur, is I walk in with my famous clipboard full of questions, usually with research that I've done to learn about things in advance. And I ask my providers the questions that I need answered, that are prepared, you know, leading up to what I anticipate the appointment might yield. And so that's kind of another skill that I've used in terms of like the self-advocacy portion. And so I think between Michele and I, we've covered some of like the three points that we had discussed among each of us, which was the patient-doctor relationship in the context of advocacy, the patient insurance relationship in that same context, and then the patient and the self or the patient and the community at large. And so I hope, and we hope that, you know, this has been, you know, kind of a useful discussion, and we wanted it to be a discussion, you know, understanding that's a webinar and, you know, you can't talk to us, you know, in the same way that we're speaking to you, but we'd love to hear, you know, some Q&A from you as well, if there are comments or questions. And as Michele had said as well, we'd also love to build this out in a way that allows for more interaction and participation from you. And we have some ideas about how to do that. But with that, I'm really, I don't want to miss the opportunity to thank Michele for having me involved in HPA, for having me involved as well. It's been a real honor, and it's been a surreal experience for me, you know, to be here and speaking in this capacity. I was in attendance as an attendee the past 2 years after my diagnosis, and to be here in this way now is really an honor for me. So thank you. And go ahead, Michele.
Okay. Thank you, Katie. I hope that everybody found that very informative. And like Katie said, we have some big plans for the coming year. And I hope that we can help you in your journey, wherever that part of your journey may be. Katie and I have had a discussion because I was younger than Katie when I was first diagnosed. I was diagnosed at 23 years old. And so the difference between what I experienced at 23 and what I'm experiencing now, and we've kind of helped each other a little bit in discovering, you know, how the journey goes. And we would love to help you. You know, that's part of our goal for the future. But we can't do that either without, because everybody's experience is somewhat individual. We need to know what you guys need from us at the HPA. What kinds of things can we be doing to further help you advocate? I do know and believe that some of the things I talked about earlier about us putting things up on the website, resources, those are going to be helpful. But I'd love to see if there's any questions that you guys have. So give me a second, Katie. I'm looking at the question board to see if there's anything coming out here. Katie, there is a question about, can you talk a little bit about your meetings with the legislators? I know we weren't going to get into legislation too much today, but there is a question out there. Can you talk about what was that like, and how do we know that it's working by meeting with them?
Sure. So I'll preface this response with I understand a certain amount of it, but really the best person to connect with on this to give an update really would be Bill, because he understands that landscape far better than I do. So maybe Michele, we can help facilitate that in a separate setting. But just to give a brief response to that, I would say, you know, it was really like kind of my first time. It was most certainly my first time doing this in this way. But in terms of how did the sessions go, I think they got better with each one that we did, because with each session that happened, I know in me personally, in relating my patient story and then in connecting it in with the experience of our community, I kept thinking of ways to relate. I kept thinking, you know, hypopara is a rare disease, right? How do I take my experience and the experience of our community, our disease community, and help people understand what we go through and what this looks like? And some of the things that I know that I had communicated in our sessions was, I need you to think about hypopara similar to diabetes, right? They're both endocrine disorders. Think about someone with diabetes living without insulin. That's what it's like for hypopara patients living without, you know, a replacement hormone. And I think that was something that resonated with the legislators who we engaged with. Something else that I said was, not only is the standard of care that we currently have, which are calcium supplements, calcitriol, you know, not only is that inadequate to resolve our symptoms, and to improve the condition, it's also harmful in the long term. And that was another thing that seemed to resonate when I was discussing. And I think to make it clear, I think some of the question also was, well, how do we know it's working? It's a very good question. We won't know it worked until we know that for sure that they wrote to the FDA in support of what we were seeking. And as I understand it, for the meetings that I participated in, each one yielded that response. Each one yielded a letter. I don't know about the other one, like if there were others that happened without me. I'm not sure what that looked like. As I think Bill had said, we got a letter each time, but I'm not positive on that. But I think just how they went in general was good. We just needed to make our condition relatable to them in some way. And I think we did a decent job of that.
Thank you. And we have another question. I think we can both try to answer a little bit from our own experience, but this patient has is a new post-surgical hypopara patient, and their endo seems to be wonderful, but has limited or no experience with proper hypopara monitoring protocols. And they are trying currently to get in with another endo with better expertise, but it's taking much longer than they thought it would, and it's frustrating. And can we recommend anything for them to be able to advocate better for themselves with their current endo? From my perspective, I would go about it from not necessarily giving up on the endo you have currently, especially if you said you like this endo. It's one thing if your endo is not up to date on protocols, and then also just not listening to you and doesn't have good bedside manner and all those other things. But if you like your endo, you have a good rapport with your endo, you need to just get comfortable enough to go in and say, look, these are the things I'm feeling, and can we discuss what we can do about that? And also come prepared with resources such as our pamphlet from our website. By the way, you can go to the website. We encourage it. We highly, highly encourage it. That pamphlet was vetted by 9 experts in the field. And a lot of the protocols that are on that pamphlet are what are going to be published in the Journal for Bone and Mineral Research that you heard 2 of the doctors talk about earlier today. So those protocols are the true standard of care for our disease at this point in time, minus, replacement hormone. Go armed with that pamphlet. Now, don't go to Dr. Google and just find some random resources and take that to your physician and say, well, I read I should do this or I should do that. I don't advise that. But if you come with some reputable resources to your physician and say, can we discuss this? Can we learn together? That's how I would approach it. You have to, don't demand things from your physician, first of all, but I try to approach it from, I really want to learn more about my disease. Can we learn this together? Or I heard about this treatment. Can we talk about it? I am very fortunate, and I know that because my endocrinologist, actually back when Natpara came out, said to me, you are so uncontrolled. I think you'd be the perfect candidate for this drug, but let me just tell you, it's new to market and it's scary because we don't know a lot about it, but I think you'd be a great candidate. So I have someone who understands the disease and is willing to work with me, but at the same token, we'll admit that I don't know everything about the disease, and so does listen to the information that I bring her. But if your physician doesn't know, don't give up on them. Help them. Katie, I don't know what you might do that might be different.
Ditch him. No, I'm just kidding. No, I support what Michele said. I think what I heard her say without actually saying it was partnership, right? So if you like, I'll say it a little bit the same, but if you like the physician you have, honestly, having a good personal relationship with your physician is a really great start. And if you really like that person, then I agree. As long as they're receptive and open to learning, if they're humble enough to admit that they don't know how to help you, but you can see that they want to, then that's a door open for opportunity to say, well, hey, what, I'm affiliated with, HPA, and they have some great resources. Can I help find some of that for you? Will you accept if I send you some information? There are clinical guidelines that can help us here. And then keep constantly, I think what I would do is keep track of your own disease. If that's a spreadsheet or a Word document or a piece of paper, it doesn't matter. Keep track of your own symptoms. One of the things that I like to do is put things in context for both myself and my physicians. So if every time I exercise, my calcium drops, right? Like, okay, now I have a pattern established. And so if you can, or every time I take a certain medication, right, it seems to affect my calcium, you know, those are contextual patterns that can help your physician understand how your disease is affecting you. So those, I think, would be some suggestions as well. And again, everything comes back to partnership. If you have a good partnership, you can make that work.
I agree wholeheartedly, Katie. And I agree, that's why that don't necessarily be so quick to throw away an endo that you like and that you have a good rapport with, just because they don't have the expertise, because you may get to someone with expertise and you can't stand their bedside manner or something else. Nobody is perfect, but if they're willing to work with you, that's a huge hurdle, huge hurdle. If they're willing to treat, a lot of our medical advisory board always talks about, we need to treat the symptoms with this disease at the current time, not worry about the standards of care, but treat the patient and their symptoms. And I think that is very important, but you have to have a physician that you have a good rapport with. And if you don't feel comfortable talking to your physician, that's part of what we're talking about today, is try to give you the tools that you need to get in that comfort zone. But I think part of it is just having a physician that you feel comfortable with. Somebody that I think has a good bedside manner, you may not feel the same way about. So it has to be someone that you get along with. And that is huge. We do have more so of a comment, but kind of goes in the same line. She's saying that they think it would be helpful for us to have a list of doctors specialized in hypopara, but not just general endocrinologists that are seeing patients. Yes, we are working on that. They go on to say that, working with your current physician, though, is important as well. We are working on at the HPA getting a list of physicians together. It's not as easy as one would think. There is about 8,000 endocrinologists in the United States, and there is no list where they just check a box and it says, hey, I know all there is to know about hypopara. We do happen to have 9 physicians that are on our medical advisory board that are considered some of the top experts in the field, including one who is in Canada. So we don't just stick to doctors who are in the United States. We are working and trying to work with them to try to figure out what is the most efficient way to narrow down doctors, besides going knocking door to door from office to office and saying, hey, do you know anything about hypopara? But there isn't a set list out there, and they don't learn a lot about it in their endocrinology school. Do you have anything to add to that, Katie?
Well, I think, Michele, the Centers for Excellence as well, might be a resource or might become a resource. And I would need to personally look into that more as well. But I think that's kind of the lane we're looking at, if I'm gathering. And I agree with that comment, about, having a list of providers, who specialize in the condition. I know it was challenging, for me, because when I was first diagnosed, even being post-surgical and not having a diagnostic issue, but having an issue, kind of coming to the realization that the endocrinologist that I was working in had a specialty that was separate from having a specialty in hypoparathyroidism. And that was a realization I had to come upon. And that was tough, because I kept pushing her and saying, thinking you're an endocrinologist, right? Like, this is an endocrine disease. You're an endocrinologist. You should understand this, right? And I had to come upon the realization eventually, when I kept, banging on that door, and I still wasn't getting better, that, okay, this is rare. And this is not something that, just because she treats thyroid cancer doesn't mean that, she doesn't have as much knowledge about hypopara. And so, I wound up then leaving that institution for my hypoparathyroidism care and transitioning to a physician who specializes in that. And so I would definitely agree, although there are almost certainly, general endos or even PCPs that can adequately manage hypoparathyroidism with the right tools and the right guidance. If you're having trouble with your general endo or your PCP in that management, then, yes, seeking an endocrinologist who specializes in our disease could be the right next step, and probably is. And I think there's definitely an opportunity for HPA to identify those physicians that are available in that setting, for sure.
Yes, for sure. Another suggestion that I would have for finding another physician, if that is the route you need to choose because your provider is not willing to work for you, besides looking for a center of excellence, some of you may not live near a center of excellence. So what you may need to think about is using telehealth. If you use telehealth, it could be not even necessarily a center of excellence, although a lot of the centers of excellence doctors do telehealth appointments. You could look for someone who's within 2-3 hours of you that would be willing to do a telehealth appointment to get started. And then maybe you only need to go see them physically once a year so that the burden of travel is not so much. So that's another good resource. I also do want to say I am so excited about a lot of these comments you guys are putting in here that are some great suggestions that will help us get the tools to you guys over the next year as we plan. I just want you to know that I am seeing them about your ideas about where to get lists of doctors from, or how to, go telling us the things that you think you need to further your journey with your personal physician. So we are seeing those. We are going to take notes of those, and hopefully we can help you more in the future. I'm just double checking to make sure there's not any more actual questions. No, it doesn't look like there is, but those are some suggestions, you guys. Please keep them coming in. Please don't be afraid to email me and let me know what else Katie and I can work on over this next year to help you guys on your journey. Katie, do you have anything else you'd like to add at the last minute?
No, I think you've covered it, Michele. Just thank you all for being present with us in this session. And I second what Michele said. We'd love to hear more from you about how we can approach the best way to provide you with resources, and help with whatever it is that you need. So we'll look forward to that.
Yeah, okay. And Loretta, are you on board? I think Loretta might have some closing notes for us. She's going to close us out for today. Katie, thank you so much for joining me. I hope you all found this informative, and I'm going to let Loretta take the lead.
Okay, thank you again, Michele. Thank you, Katie. It was wonderful to meet you finally.